My name is Dusty Anderson. I'm the Director of Rehab and also the co-owner of Aviator Home Health. My journey actually started at the age of 16 in the field of physical therapy. Played many sports growing up. I was an avid baseball player. I was a pitcher. Had multiple injuries my senior year in high school that actually prevented me from playing college baseball. I was very frustrated with the process and the lack of information to basically keep me playing and just the gap out there. And so I found the passion in sports medicine. I actually started, my first job was in sports medicine, outpatient orthopedics, and I loved it. I was able to actually work with baseball players and young kids and get them to the level where they were able to take care of their bodies. They were able to know the education that I provided them from having been there and just seeing what happens in an outpatient clinic if you don't take care of yourself. So I was able to relate to them a lot better than the average PT. And so we developed a lot of strength programs, a lot of proactive strengthening rehab protocols to keep these kids playing. I did that for about 7 years, and then actually started into the home health business, still in orthopedics. I started doing just a spot therapy every now and then, 1 or 2 treatments here or there. And I noticed that there was such a gap in home care between the actual surgery date in orthopedics and 2 to 3 weeks before they go to outpatient. I saw that on many different levels. I saw that once I was an outpatient PT, the lack of progress, how far they were behind, and you would ask them what they were doing in home care, and they would tell you 4 or 5 different exercises and just walking in a circle basically. So it was kind of my, it was a seed that was planted in me for, right at the beginning of home care. I was like, there's some way that we can get through this and actually improve the level of care that these people are receiving at home. And so I started doing, like I said, dabbling in home care. Met David. Actually, he was one of our students at physical therapy and outpatient, so I knew him there. And we both kind of have the same mentality. We want to give the patient the highest level of skilled care possible. And so we came up basically with a manual therapy approach to all our patients. Not only the orthopedics manual therapy is very, very beneficial. And that's actually where the clinician puts their hands on the patient and actually physically, facilitates range of motion, decreased swelling, increased mobility. There's a lot of things and changes that we can make with our hands. However, that's not always the approach in home care PT. I pride ourselves with, basically we have 37 PTs on staff with Aviator Home Health. And I've basically recruited them personally from outpatient clinics. Because of outpatient, the PTs typically have a higher level of creative thinking. They're able to think outside the box, tailor the program to you, and not basically be a cookie cut PT. So that's what we did. We started with very few PTs, David and myself. We actually were the PTA team. And we just started basically bringing different clinicians in to basically buy into our methodology. We trained them, and I'm still responsible for their training of manual therapy, which we provide to our PTs 1 time a month. So that's kind of our methodology on the PT side, is to put our hands on you. It's the studies, the evidence-based studies have shown that there's a dramatic increase and actually a decrease in rehab time with the manual therapy approach. So we not only do with orthopedics, we do with all types of diagnosis that might warrant that. And so whatever it takes to increase mobility, improve balance, whatever it might be, core stability, however you're lacking, we tailor that program to you with a corrective exercise program, not a home exercise program. We call it a corrective exercises because we don't overload you. We give you exercises that you need in order to strengthen the muscles that we feel like you have a deficit at. And so we're very specific to the patient, along with the manual therapy to conclude, and basically every patient that we see gets some type of manual therapy. I think the main thing that separates us from everyone else is the quality of staff, physical therapists, PTAs, OTs, whatever the discipline might be, the quality of staff. And when I say that, it's basically when I'm interviewing somebody, I'm looking for those intangibles, the heart, the drive, the compassion, the basically that you were meant and designed to do this and actually help people. Like I tell all the people I work with and all the PTs I come in contact with, I can teach you skill. I can teach you that those skills that's going to help better a patient, but I can't teach that intangible, the heart, the drive, the passion to actually want the patient to be better. I want my PTs, and in fact, I pride myself in this, that the PTs all act like we have 20 grandmas each, or we become family, basically. It's the intangible that we bring to the table that also helps facilitate healing. When I say that, I'm talking about the psychosocial aspect of PT. You can have a really good PT that's highly skilled and highly credentialed, go in with the patient, but if they are not able to establish that connection with that patient, gain that trust, basically develop that rapport, and the fact that that patient will trust you in anything you guide him to do. That's the type of PTs we have. The ones that actually care, the ones that actually you don't have to tell them to do anything extra. They go above and beyond. And not only do they have that drive, compassion, and heart, but they also have the level of skill that you would find at the highest level outpatient care. And so our whole goal here is basically to bring the outpatient to the home. The patient in the home can facilitate healing a lot quicker. They're in the comfort of their own environment. We get to know the patient, we actually care about the patient, and we follow up with the patient. And it's really neat to have a patient come back or refer others of their family to you because you made such an impact. And so that's what I tell, and I challenge my PTs on a daily basis. Make an impact. And like I said, it's not just the skill that makes the impact, it's the heart and passion and drive. And that's an intangible that, believe it or not, is harder to find in the PT world. So in conclusion, that's basically what separates us as PTs with Aviator, is that across the board, we don't have a weak link. We have 37 PTs currently on staff, and every one of them are very, very good at what they do and have a heart of gold. And so that you can guarantee that the patient will be taken care of from start to finish. The family will feel comforted, and we will get better faster, and we will become friends along the way. The LSVT BIG program is specifically designed for our Parkinson's patients. Basically with Parkinson's patients, one of their main issues is motor function, what we call our Parkinsonian gait, where they're at high risk for falls. They're not able to basically reach outside their base of support. So with the BIG program, it's a very hands-on program. It's at least minimal 4 days a week, and usually we alternate PT and OT in to do the program. And basically what it's composed of, it's basically one-on-one, and what we're teaching them is to really get outside their base of support and really try to overemphasize these big, large movements with simple cueing in order for the patient to better have feedback to the motor cortex of the brain and the muscle. So that's kind of what the LSVT in a nutshell is. It's a very in-depth program for our Parkinson's patients, and we have seen excellent results with it. The instrument-assisted soft tissue mobilization is an advanced manual therapy technique that you would see in an outpatient clinic. With that being said, as you know, and I've mentioned that we basically on the Aviator therapy team pride ourselves in being the elite and cutting edge on any PT treatments out there. So we've actually began to implement what we call the EDGE tool, and it's basically a tool that we use to manipulate soft tissue. It really addresses the fascial restrictions with chronic pain patients. It's also used and utilized with orthopedic patients, both acute and subacute, chronic knee pain, whatever it might be. It's just an advanced form of manual therapy. Instead of the therapist actually using their hands, they actually use an instrument that actually better selects the tissue and fine-tunes the exact spot that we need to work on. So it's a pretty cool little technique that the therapists love to use. It's pretty cool that you can feel the tissue or the restriction in the tissue actually amplify through the tool, and so it gives the PT a better idea and more selective spot to treat. And so that's how we utilize that, and we will continue to utilize that on a bigger scale as time progresses. Feel free anytime to reach out to me personally. You can reach me via email at dusty@aviatorhh.com, or feel free to visit us on our website at www.aviatorhomehealth.com.